Join Doctors Savanah Craig and Ronnetta Sartor as we navigate life beyond graduation, real conversations about forging our own paths in our early years in our careers. There's a reason it's called practicing dentistry.
Hello and welcome back to Beyond Graduation with Dr. Craig and Dr. Sartor. This week we are talking about identity, and by identity we mean identity as a doctor. Coming out of school, going into residency, going into your first job outside of residency, or if you come straight out of school, what's your identity and do you know who you are? Or are we all just pretending until we figure it out? What is your take, Savanah?
I think it's really ironic because, in dental school, you're like, I just want those letters after my name. I just want to be Dr. Craig. And then still to this day, there are times where, like, I don't know, my mom will do it ironically. And there's still a moment of like, oh, that is me. Like, I did earn this. And I think there's some like imposter syndrome to that. So I have mixed feelings about it the longer it goes on. And I think another piece of it that's been very funny to me is like, I don't know, I got an email from like my new boss and wanting to call him, doctor whatever in every email, but not wanting him to call me Dr. Craig. You know what I mean? Like I signed my email Savanah, but then referred to him as that. And it's realizing now that like we're sort of on the same level and there's like a respect thing to it, but I don't know why it makes me uncomfortable, but it does sometimes.
That's understood. I mean, it is a very awkward transition.
Yeah.
Because in school most of the time they didn't really call you doctor.
Mm-mm.
As you got closer to graduation, they may just to kind of start testing the waters, but it's a very, very good point. And I think for me, as it pertained to identity, one of the things that I struggle with the most coming out is patients always coming in and saying, "Are you even old enough to be the doctor?" And I kind of made light of it and would just say things like, "Yeah, I am." And then you read the room and you know if like they're serious or they're just joking.
Yeah.
So some of them who are serious, I'll let them know, yeah, I just have a baby face, but I assure you I went to school and went to residency and did all of these things and had these experiences and pretty much give them a rundown of the education that I've had and assure them that even though I may be a younger doctor, I'm here to serve in their best interest.
Yeah, I think I definitely had that experience with a patient, and I knew they wouldn't like, yeah, I've been doing this 11 months. So I was like, oh, I've been doing this for 3 years. I like counted clinic in dental school because it just seemed better.
Yeah, dentistry is one of the fields that is a little bit different, especially when you look at our MD friends, because when we're in dental school, we actually get a lot of clinical experience of having our own patients and treating our own patients. And I think a lot of patients don't know or realize that until, sometimes you have that conversation with them. And that's not saying go and tell your patients, oh yeah, I saw all of these patients in school. But I think it does bring up a really good point.
Yeah, I think residency, and I don't know if you had this experience, but we see a lot of patients who work in the hospital. And so physicians and nurses and PAs can have an idea in their mind of like what a resident is or could be. And so some of them had a problem with us being residents, and just reminding them like, hey, I'm choosing to be here. Like I could be out opening a practice and you would have no idea that I just graduated a year ago. Um, but my attendings made it a really good point to, from day one, address you as doctor and, hey, doc, do you need anything? And sort of beat that into you in a way that I really did. Or there are times where I'll be like, hey, what do you think about this? And they're like, I don't know, doctor. What do you think? And I don't know. I think going into practice now, I really have to own that. Like, not that there's not people I can ask questions to, but like, nobody's coming to save you. These are your decisions, and you're at the end of the line now. So I think that's nerve-wracking.
Those are very, very, very good points. Very good points. I think too, in both of our cases, it's that we have the experience of being young doctors, but also young female doctors in a profession that had traditionally been predominantly a male dominated field. So I remember in dental school and in residency, I would have some patients that would say, I've never had a lady dentist before. And, I would have some patients that would try to call me by my first name or call me Mrs. instead of doctor.
Yep.
With humor, I addressed those situations as best as I could. I don't know, what's your experience been?
Yeah, I think it's been less so than I expected in residency that I've had that issue. And I think one, we wear different colored scrubs. The assistants and the hygienists make a really good point to introduce you as such. But in dental school or like out and about telling people, yeah, I'm a dentist, people are like, oh, so you're a hygienist. Not that there's anything wrong with being a hygienist. It's very funny because my mom is a hygienist and she's the first one to be like, no, like you will address her as doctor.
That's so funny.
So shout out to my mom. But yeah, I think there's still so far for people to go in like getting used to females in the profession and stuff like that. It's crazy when it happens.
Yeah, it's two-sided too, because
sure.
in residency we would have, I thought it was the funniest thing at the time, but we would have some patients call and request a female dentist, but for different reasons. Like one patient said, I have a very tiny mouth. Female dentists tend to have smaller hands and are more gentle. There are some patients that feel like female dentists are more patient and gentle with children.
Yeah.
And so they seek out female dentists for that. So I see it both ways.
For sure.
And I do think, like you said, over time, especially because more and more females are entering the profession, and at some point we might be at a point where it's just as many females who are practicing dentists than they are males. It'll become less of a whole thing. But I think it brings up a point that patients have preferences, and that's okay.
Yeah. One thing, maybe it's different now because you own the practice, but I've noticed, so there were 3 of us that were female residents and then 3 male residents. And those of us, we would introduce ourselves, walk in the room, say, "Hey, I'm Dr. Craig." But a lot of the guys would go in and introduce themselves first and last name, and there was never like a question that they were the doctor. Have you had that experience, or how do you introduce yourself to new patients, I guess?
I almost never say my first name.
Yeah.
I just go in and say, "Hello, I'm Dr. Sartor."
Yeah.
And my last name is weird, so we make jokes about my last name. So I say, "Well, if you can't pronounce it, I go by Dr. S, or just call me Dog. I'll answer." And that tends to be enough for them.
Yeah.
Yeah, that tends to be enough. But you do make a very good point that I do think, and it might be because females have a history of having that type of identity crisis from the beginning. We just say, "Hey, I'm Dr. So and so," and then going from there.
Yeah. Some of my co-residents who are going into practices that have been only men are really concerned about, should I wear a white coat? How should my name be on my scrubs to like avoid confusion? Make sure I don't wear the same color scrubs as the assistants.
hmm Now, I did put my name on my scrubs, but it was more so because my last name is not a common name, and I would frequently be asked by patients, "How do you spell it?"
Yeah.
so that they can pronounce it. So it was just very easy for me to point and for them to look, and so that's why I put my name on my scrubs. I didn't wear a white coat at all, and you probably will be similar to that in that I did a lot of surgery,
Yeah.
and so a white coat and what might become of a surgery are not a good mix.
Yeah.
So, for that reason and that reason only, I didn't wear a white coat too much. I would wear my hair down a lot because when my hair was down, even if I had a headband on and it back, in my mind, I felt that I looked a little bit older. I think it's the equivalent of like our male counterparts growing beards and facial hair because they look a little bit older. But over time, as I became more confident in myself, I stopped doing that
Yeah.
because my hair just get in the way. So I pull it back in a ponytail holder, and this is the young face that you get. And I go into it with confidence, and we make some jokes about it, and we get the show on the road.
Yeah. You get what you get, and you know, this is my skill set. I think that comes with time too. Hopefully, hopefully the imposter syndrome gets better. Has that been your experience?
I feel like it does.
Good.
I remember in dental school, it probably was a terrible way to think of it, but it, my classmates and I think it made us feel better as we transitioned from like being strictly didactic into the more clinical standpoint. I just remember us telling each other to encourage ourselves, just kind of, do as much studying and practicing on the typodon as you can. But if you have to go in and fake it till you make it, like do so.
Mm-hmm.
But with confidence and the more you do things, the more that you don't have to fake it anymore. It is what you become, is who you are, and
It all works out in the end.
mm-hmm.
Yeah, I think, I don't know. It's a lot to get used to, but I don't know. There are times in my own head of just like, okay, you are the doctor, you earned this. It's okay. Like keep going.
Yeah, it's funny. In residency, because if you know South Carolina, you know that the Low Country, we kind of have different accents from different places in South Carolina. So One of the things that I worked on a whole bunch is my accent and how I said things. So I would sound professional. And then over time, I think it improved, but I also stopped thinking about it as much because I found that I ended up in places and treating patient populations that understood it and even embraced it.
Yeah.
And so it kind of taught me, to not be so critical of myself. Yeah, because it's something about me that makes me unique, and it doesn't take away from who I am as a professional. If anything, it just kind of makes me a special little snowflake, I guess.
Added flavor.
Yeah.
I think that sort of comes down to the whole, you'll find the patients who embrace you and who you are and the way you deliver treatment and the way you interact with them. And I think that I'm starting to get that. In dental school, I needed those patients more than they needed me some days. Please, I need to graduate. And so I think now just having the confidence to be like, this is how I am and this is who I am. And if you don't like that, you are welcome to find a dentist who, meshes more with what you're looking for. But I think it's frustrating sometimes, especially when they don't even give you a shot because you're young or you're female or talking about accents. I'm a northerner in South Carolina. I've had some patients who didn't like that, which was, of all the things I expected to have to overcome, that was not one of them. But two of the patients who jokingly or for serious were apprehensive about being young, being female, ended up being some of my favorite patients who, we got over that and they trusted me. And I don't know, like, let me show you what I can do before you make that judgment, I guess.
Yeah, I think overall it seems like when we get down to the bottom of it, it just seems that both of us are saying to embrace who you are. If you're young, if you're female, if you have an accent or you're from up north, or you have anything else that makes you super unique, it's just going to make you an even better provider. And the sooner you embrace it, the sooner you'll be able to embrace who you are and be the best, dentist that you can be for your patients. What are your final thoughts, Savanah?
I think that's really well said. Of, your uniqueness is bringing something special to your community and your practice, and don't think you need to change that for anybody. Let us know what your thoughts are on your identity and how you feel about being called doctor or not. Message us on social media and let us know what you think. Thanks for tuning in.
Thank you for joining us for this episode of Beyond Graduation. If you enjoyed this week's episode, be sure to share it with a friend. Connect with us on social media at Savanah Craig DDS and at Dr. _Sartor. And remember, you are not alone on this journey.